Good morning. Thank you all so much. Welcome to State Center Community College District. I am Frances Garza, the benefits coordinator, and we have Raina Kimball here as well, the benefits technician. Most of you as new hires probably met Raina already or have already talked to her, but just to remind you, this session is being recorded. So I'm going to start sharing my screen so that you can actually review our PowerPoint presentation. And 1 second. Okay, are you all able to see that now? Okay, perfect. So as I mentioned, we're the benefits staff. Raina handles all of our new hire benefit enrollment. She handles all of our questions regarding benefits or insurance. She also handles the insurance claim issues, retiree billing, and eligibility questions. So as the coordinator, I handle most of the administration of the programs for benefits and workers' comp, as well as the complicated benefit issues and our retiree health insurance planning options. We do have a general mailbox that's up at the top that benefits at scccd.edu. So if you ever need to reach us, you can send emails to that specific box. Ourselves, as well as a couple of other HR staff members, have access to it so that we can answer your questions as soon as possible. So what we handle in the HR benefits staff office is we handle the employee health insurance benefits, which is your medical, your dental, your vision, your life insurance, the employee assistance program, and the long-term disability insurance. We also handle the retiree health insurance program and the workers' compensation program. So what to do if you happen to be injured while you're at the job or on site at one of our campuses? You're going to see these posters. They're company nurse posters. This is our third-party administrator that handles all of our reporting of our work-related injuries and illnesses. So whenever you have an injury or illness that arose out of and in the course of employment, we do ask that you call company nurse as soon as possible to report the injury. We also ask that you notify your manager within 24 hours of when the actual injury occurred. So as I mentioned, company nurse, these flyers are all over the campus, all over the district offices. And if you happen to need a wallet card, we do have those. So just shoot us an email, we can get one to you. But this is available 24 hours a day, 7 days a week. So self-insured or self-funded health plans and what this means. So a lot of individuals, you know, they have some difficulty understanding the different health insurance plan options we have. You're going to hear a lot as an employee of the district that our plans are self-funded. And what this means is that we basically assume the risk of the assume the financial risk of the health plans. What that means is we pay a monthly premium every month into our actual health plans. So it's the Modern Care, the Bronze PPO, our dental PPO plans, and our vision insurance plan. And what we do with these premiums is they get put into like a bank, and as members start to use services, members and their dependents, whether it's for lab work, doctor visits, all of the fun sort, the plan actually then submits the monies to the claim to pay that claim. So every time as a member goes in to use services, the district, as part of our joint powers authority, we are paying for those individual claims. So the EdCare group is our joint powers authority. That's basically our little pool of school districts that we've actually gotten into to help pay these claims. And EdCare has a broker, which is actually Bartholdi and Associates. Their website is located here. So if you ever need them as a resource, you need to look up your plan documents, or you just have frequently asked questions, you can look up on their website. They do have an email submission where you can submit your questions. There's also a phone number here. Our broker who we deal with directly is Gina Catone. So please keep it in mind if you ever need to reach out to somebody and we're not available, please feel free to reach out to Bartholdi and Associates. So now I'm going to pass it over to Raina.
Hi, good morning, everyone. I'm going to get started with the health insurance benefits and who the eligible employees are. The district currently offers benefits to all eligible full-time employees. That includes full-time management and confidential employees, our classified members that work 30 or more hours per week, our police officers, and our faculty members with a 60% or greater full-time load, and anybody else that qualifies under the ACA guidelines. Our initial enrollment period is 31 days, including your date of hire. So it's important to log into your portals and get your onboarding set up. Benefits become active for faculty, confidential, and management the first of the month following your date of hire. So if you're hired August 5th, your benefits become effective September 1st if you fall under the faculty, confidential, or management classifications. Medical benefits only become effective for classified members the first month following their date of hire, and their dental, vision, and life benefits become effective 6 months after their medical benefits are active. So if you have any questions on that, make sure to reach out. We can clear that up and get you set up with dates. We also send out confirmations of enrollment for these plans. Here are the two onboarding systems that we use. The Talent Ed is used for faculty members, and our Neo Ed is used for classified, confidential, and some of our management. So I'm sure our HR staff pointed you in either direction to whichever applied to your classification. This is where you do all of your onboarding and make your selections for your medical benefits. Here are some examples of our enrollment forms for our new hires. The first form is our EdCare form. This form is for our two PPO options, Modern Care and Bronze, as well as our vision and dental. This form has to be filled out by all eligible employees, regardless if you choose the PPO plans or the Kaiser plan for the dental and vision. So that form has to be filled out. And then next is our Kaiser enrollment form. That one is if you choose to enroll in either of our HMO plans through Kaiser. Again, the EdCare form has to be filled out as well to enroll in the dental and vision. The third form is our life insurance beneficiary form, or our life insurance enrollment form. This one has to be filled out as well for all eligible members. And this is just to keep you enrolled in our life insurance form and to designate beneficiaries. Let us know if you have any questions about these forms. The next two forms are our voluntary options. The district offers members to elect a pre-taxed medical premiums. So if you'd like to get some long-term savings with your pre-taxed premiums, that would be the form you fill out for that. We highly recommend everyone fill that form out. If you miss this form during your initial enrollment period, you can make that selection during open enrollment this year. The last voluntary form is our voluntary long-term disability. If you'd like to make either of those, any of those elections, make sure to fill this form out. Ask us if you have any questions. This form and the pricing for this benefit is based on your salary and age. So let's dive into our health insurance plans and the overview. The district currently offers 4 different plans, 2 PPO plans, that's the Bronze and Modern Care. Next to that, you can see the monthly premiums and what the employee payroll deductions would be for the 2 PPO plans. And then we have our Kaiser HMO plans, their premiums, and what the employee payroll deductions would be. The district also offers dental, vision, and life. Currently, all of those plans are paid for, those premiums are paid for 100% by the district. And then, so to go into some of our in-network benefit summaries. All right. So here is a more detailed breakdown of the 4 plans that we currently offer. Annual deductibles are the member's out-of-pocket responsibility before the plan starts picking up their portion. For example, a member enrolled in our Modern Care pays their $400 deductible. And then their claims will start being paid at 90%. Then that brings me to our co-insurance. So co-insurance is the percentage that each member pays towards their plan. So once the deductible is paid, modern care members are responsible for 10% of their services billed. This gets a little tricky and scary to think about having to pay a percentage care for your care for some members and services, as they do get expensive. This is where the out-of-pocket maximum comes into play. In a calendar year, individuals will only pay for services up to their out-of-pocket maximums. For example, an individual on the modern care plan will only pay $3,000 in a calendar year for services. If you need a service, or if you had a service that exceeds this amount, the plan picks up the excess of your out-of-pocket max. So anything over that $3,000, the plan will pick up. If you have any questions about a bill you received or you do receive in the future, and they're asking you to pay over that out-of-pocket maximum, please reach out to our department so we can help you get that billing squared away. Also listed are the different copays for primary care physicians and specialists. Note our PPO members do not need a referral to see some specialists, but some specialists require a referral. So make sure you get that information ahead of time, and make sure you're checking to see if physicians are within our network to save you some money. All right, now let's look into our modern care PPO and bronze plan. As Francis mentioned, these plans through EdCare are self-funded, so we assume the risk and pay for claims out of that bucket of money that we receive from premiums each month. Our PPO plans are administered by Delta Health Systems, but we use the Anthem Blue Cross provider network. This is important to note to make sure your providers are billing the correct entities. Anthem does not process our claims. All of our medical claims go to Delta Health Systems. So any referrals, or if you're looking for specialists and doctors, you're going to need to make sure that they're within the Anthem Blue Cross provider network. And it's your responsibility to ensure that those members are in that network for billing purposes. Currently, the modern care plan does offer out-of-network benefits at a higher cost to the employee, and the bronze plan does not offer any out-of-network benefits. Also, our PPO plans do coordinate with other PPO plans. So if you have a spouse that you are also enrolled in, or a partner that you're enrolled in their medical plan and they have a PPO, make sure you're showing your providers both insurance companies to make sure that you're maximizing your out-of-pockets between the both plans. Both of these plans also offer weight management programs, Baby Connect, and all preventative care services are covered at 100%. Here's a quick snap of the Delta Health System member portal. This is a great resource to check for explanation of benefits to ensure that your claims are being processed correctly. You can also print a temporary ID card and search for providers. There are also other required and requested forms like the coordination of benefits and third-party liability. Here's a quick look at what that landing page looks like for the Delta Health System members, for the PPO members. And there's a ton of resources and different information you have available to you through this portal. All right, because we are self-funded, we look at options to make the best plan in pricing and benefits. Some services and benefits have been carved out from the Anthem providers and other providers like Halcyon and Physmetrics to help cover costs for mental health and substance abuse. For some information on finding providers for these, you can reach out to Halcyon directly. They're our administrators for our mental health and substance abuse program. And then you can reach out directly to Physmetrics for chiropractic physical therapy, occupational therapy, and speech and language therapy services. Our PPO plans currently use IPM, Integrated Prescription Management, for our drug benefit. There is a mandatory generic prescription drug program in place to help us save costs. They also have a program for variable copay assistance. So make sure to check that out if you have any questions about their pricing. There are prescription drug limitations and exclusions for certain medications. High dollar medications are excluded. Specialty drugs like to treat rare conditions and diseases. Certain prescriptions are required to have pre-authorization and or use step therapy. So make sure that before you're taking some of these prescriptions in, that you're checking to be sure that it's covered and that you don't need prior authorization. All new prescriptions and drugs to the marketplace will require a prior authorization. So if you ever prescribed something new, just know that you will need that prior authorization. All mail order is required for all maintenance drugs after 2 refills. This is important. We get a lot of people who are denied their prescriptions when they go to pick it up because you have to move your maintenance drugs over to either BK Pharmacy and their mail order program or their Walgreens mail order program. So if you have any questions, make sure to check out IPM. They also have a portal where you can review benefit summaries, the prescription drug formularies, claim history. BK Pharmacy also allows our members through the portal to submit for their next mail orders. You can also find which drugs are part of the prior authorization and STEP program. And you can review standard exclusions. Not everything is always on that as the industry changes, but you can find the list there. All right, now let's jump into our Kaiser plans. We are part of the Kaiser Permanente North region. We offer Kaiser Low and a Kaiser High plans for members. So 2 options. And Kaiser does a really good job about informing members of their fee schedule. So when you are sent for a procedure or labs or anything, you can look up their fee schedule to see what your out-of-pocket will be. Most Kaiser facilities and medical centers offers the one-stop service, like your primary care specialists and all of your labs and pharmacy. So that's really nice for some members to have it all under one roof. Kaiser does not coordinate with other HMO plans. They only coordinate with other Kaiser HMO plans. So if you're enrolled in a partner's insurance and they have Kaiser, make sure you're showing them both insurance cards to make sure you're maximizing your care. Kaiser also offers some other complementary services like wellness coaching, other health and wellness classes. They have 2 apps, the Calm and My Strength app for mental health and some of their preventative care. They also offer some class passes for fitness. So make sure you check out the Kaiser portal and look at some of the other complementary services they offer to our Kaiser members. Okay, now let's jump into dental, vision, and life insurance. Our dental insurance is administered by Emeritus, and we are based on an incentive level. So all new employees start out at a 70% of the annual limit of 1,750. And each year, as you receive services, your incentive level increases 10%. So make sure that you and your dependents are using that plan every year to increase your incentive level to that 100% of that annual limit. If you don't use it in a year, then your incentive level will not increase. It won't decrease, but it won't increase. So make sure you're getting in for some type of service each year. Orthodontia is paid at 50% up to $1,250 per lifetime. So that's a one-time use on that benefit. Our annual limit for dental reviews the first of each year. And this plan does offer some out-of-network benefits. However, it is at a higher cost to employees. So make sure you're checking emeritus to see what dentists are in network. Emeritus also has a portal so that you can find information on claims, providers in your network, and look over EOBs to ensure your billing is done properly. Next is vision. Our vision is handled and administered by VSP, Vision Service Plan providers. Each member has access to a well vision exam once every 12 months from the last date of service. Our eye exams have a $10 copay. We are allowed lenses every 12 months, frames every 24 months, and our frame allowance is $170 every 24 months. We also have access to contacts in lieu of glasses, so we have to choose one or the other. Contacts allowance is $130 every 12 months, and the exam for the exam and the fitting is a copay maximum of $60. So it really depends on the provider and what their fee schedule is, but you shouldn't pay more than $60 for your lens exam. VSP also has some exclusive member extras like their frame showroom Iconic. They also offer discounts with some diabetes care, LASIK, and hearing aids through the third-party company True Hearing. If you have any questions about these, let us know or contact VSP. VSP also has a member portal where you can look at these different extras and find in-network providers and take a look at their Iconic showroom. Next is life and accidental death and dismemberment. That's never fun to say. Our life insurance plan is administered by Voya, and all eligible benefit employees receive a $50,000 life insurance policy. And all of the eligible dependents enrolled on the employee's medical plan receive a $5,000 policy. So if your dependents are enrolled in your medical plan, they have access to that $5,000 policy. If they are only enrolled in dental or vision or not enrolled at all, they do not have access to that plan. So that might be something to think about during your initial enrollment period or during open enrollment. Make sure that that form is filled out that you saw towards the beginning of the presentation. We also encourage you to review and update your beneficiary form often. Make sure if any life changes happen that you inform us and keep this beneficiary form updated, because in the event that something happens, we have to go off of this form. And so we don't want anybody collecting monies that you wouldn't want. So make sure you are keeping that form up to date. For more information, you can look at the plan summary for life insurance on the benefits website. And now I'm going to hand it back to Frances for our employee assistance program.
Thank you, Rena. So I'm going to talk about the employee assistance program now. Our employee assistance program is actually administered by Halcyon EAP. I don't know if any of you heard of it before or had it at another job, but it is a really good resource to have. Our EAP benefits are for benefit eligible employees and anyone in their household. I like to stress that anyone in your household and give you some ideas of who that might mean. So let's just say you have a friend living with you, or you have a mother-in-law living with you. They are eligible to receive these free EAP health services. So it's a really great benefit. There is no charge to the employee or the individual who uses it. What it does is it offers confidential counseling service. You can do it face-to-face. They offer now through texting as well as FaceTime. They also offer referrals out to community agencies if you need some legal assistance, financial assistance, or family assistance. The great thing about this, it's available 24 hours a day, 7 days a week. Employees and their eligible dependents get 3 free sessions every 6 months per issue. So if you have an issue where you're dealing with a rebellious teen, that's your one issue. If you also have an issue with dealing with stress at work, because we all know we get there, that's another issue. So it's another 3 free sessions. So just keep this in the back of your mind that this is something that you have. As you have time, please go in and look at it. We send out a lot of information every month on EAP. Whether it's a webinar or just an article that talks about some things that are common as of today, like COVID. They also offer emotional fitness coaching, which I mentioned is their text therapy. They also just recently implemented an app called Navigator, and what that does is it helps you determine what services you actually need. So on our next slide here, what EAP is for, it's for short-term mental health issues. So if somebody has a long-term mental health issue that goes over the 3 free sessions, then basically that's going to hit your medical plan, whether it's your Modern Care plan, your Bronze plan, or your Kaiser plans. So you can use your 3 free EAP sessions, but then after that, you'll be referred to your medical plan. Halcyon, what's great about them is they will work to maintain that relationship that you've had with your provider. So you get to stay with your provider, even though you're part of the Modern Care plan, the Bronze plan, or the Kaiser plans. So it's a really great benefit. If you're in doubt of where to start, please call Halcyon at their 888 number here. You will speak with a licensed counselor who can triage you or your dependent and get you to the care that you need. I always like to stress to individuals, if you are in a situation where you need care at that moment, please let the counselor know. Too many times individuals don't say anything, and then their situation is getting worse. Because I like to stress this, because our referrals do take 24 to 48 hours to happen. So that's 24 to 48 hours that you're sitting there trying to figure out what to do. So definitely, whenever you need to talk to somebody and you need to talk to that licensed counselor, call Halcyon Behavioral and they can assist you. The Halcyon EAP website also has a ton of resources. They have online seminars, they have e-learning seminars and skills. They have budget worksheets if you need to help, establish a budget. When I was looking for a home, they had stuff on what you need to look for in your home. So it's a wealth of information, and it's all for free. So why not log in and check it out? Their website is here, halcyoneap.com, and our username is EdCare. So voluntary products and benefits. We offer a lot of voluntary products and benefits. One of them happens to be our voluntary long-term disability. Now, voluntary long-term disability is one of those things that, you see sometimes and you're like, I don't know if I'll need that, or do I really need that? It is one of those, you just have to look at your personal situation and what you need. What this does is it covers up to 60% of your eligible monthly salary, up to a maximum of $5,000 per month. It will actually pay you in the event that you cannot work and you're not getting any pay from the district. So that means you have to be totally disabled, unable to perform the essential functions of your job, and that you are being regularly cared for by a physician. So it's a great benefit. I can tell you that most of our individuals or our employees, we have so many leaves in the book that it really takes a long time to actually hit your long-term disability plan. But if you are dealing with something that's like a chronic illness and you want to have this in your back pocket, it's definitely a good benefit. It is something that employees do pay for at cost. As Raina mentioned earlier, your rate sheet is actually in your new hire onboarding portals. So if you need to verify what your monthly rate would be, you can calculate it out yourself. If you have any difficulty or need some assistance, please reach out to Raina or our benefits box, and we can definitely help you through that. One of the things I like to mention is upon initial hire, you do have a guaranteed eligibility for this plan. If you decide not to elect it during your initial enrollment period, and you decide during open enrollment that you want to apply for it, you do have to go through what's called an evidence of insurability. What that is it's a medical questionnaire. So at that point in time, you would have to be approved to have the benefit, and that would go through Voya Financial, which is our plan administrator. So just an FYI. Other voluntary products and benefits are offered through Aflac and American Fidelity. Those are the two vendors that we have. that are allowed to sell and have payroll deductions through the district. So for life insurance, you can get additional life insurance. You can get personal life insurance for a spouse, children, grandchildren, and you can do that through American Fidelity or Aflac, and their numbers are here. If you need accident insurance, excuse me, I went ahead here. Accident insurance, short-term disability, and short-term disability is probably one that most individuals use because, you know, if they go out and they're off work for like a week, it's something that they can actually tap into a little sooner. But critical illness, cancer insurance, and they have a wealth of other miscellaneous insurance products. All of these products are paid for at cost by the employee. The great thing about it, though, is usually when you tap into these benefits, if you should happen to leave employment with the district, you can definitely take those with you. We also offer tax sheltered annuities or supplemental retirement plans. So those are 403B plans and 457 plans. Our 457 is currently through CalPERS. There's also a CalSTRS pension too. So these plans you can opt into at any point in time. You can adjust your what you actually want to put into them at any point in time. So please work with our district payroll department to get those set up or to also help you go through the process to get that election form done. So our Section 125 and flexible spending accounts. This is a fun one because our plan actually runs October 1st through September 30th, just like our health insurance. So we are currently going into open enrollments. And if you are a new hire, you have your 31 days to enroll. But also for our new employees, during the open enrollment period, you're setting up deductions for the October 1st plan year. So we will be shooting out information in regards to how to apply and enroll in your flexible spending accounts. So keep a lookout for that. But what it is it allows you to pre-tax your monthly medical plan employee payroll deduction and set aside monies towards qualified medical expenses or dependent daycare expenses. One of the things here that I pointed out in red is it's a use it or lose it. So the district's policy right now currently is you have to use all of your FSA fund selections that you've decided to take out for the year. And if you don't use them, you will lose them. So if you take out the max, so on the next slide, you can see the maximums. If you happen to take out the maxes and you don't use all that money, unfortunately, you do lose it for the year. So definitely sort of gauge out what you're going to use them for, what you think your expenses are going to be, and set that out. Your actual deductions will come out over a 12-month period, and it just helps to lower your pre-tax or to help you on the pre-tax basis. So some benefits to take advantage of. One of them is our telemedicine options through all of the healthcare plans. So our telemedicine option through the PPO plan is Live Health Online. Now, Live Health Online is pretty new. A lot of Anthem Blue Cross plans use it. And so it's really great to see that the PPO plans are now starting to evolve with our telemedicine options. What it does is it offers you a face-to-face over the phone office visit, which is pretty neat. So all you need is your smartphone, your iPad, your tablet, or your computer, and you can have these conversations with the doctor. You can get prescriptions prescribed if needed. You can get determinations if you need to go to ER or urgent care. I can tell you I've used it. I love it. Kept me from having to go to the ER in the middle of the night, which I was thankful for. And Kaiser also offers something very similar, which is their My Doctor online app. You can schedule individual appointments with your specific doctor through Kaiser. But you can also use the app to determine if you need to go into the ER, if you need to go into urgent care. With COVID, a lot of things changed, and we were starting to see that this was definitely the way that most insurers were going. So it's a really great benefit to have. With Kaiser and PPO, you actually do not pay any copays when you use these services. So take advantage of them. So expecting mothers. So our Modern Care and our Bronze plan do offer a Baby Connect program, which is provided to our expecting mothers at no additional cost. Individuals who get pregnant and wish to sign up can sign up with the Delta Teen Care. The number is provided here. And you will be connected with a specific maternity specialist that will help you throughout your pregnancy and through postpartum. This program is not available for dependent children who may be pregnant, just an FYI, but it is one of those benefits that, you just forget about, you don't think you need it. And whether it's your first baby or it's your third child, it's here for you to use. So it's just a resource for you to have. Kaiser High and Low both offer what's called your pregnancy app. It's pretty neat, but you can get fitness tips, you can get things on what to eat, what to be concerned about. There's a corner called Partners Corner, which is really neat. You can also sign up for prenatal classes, get weekly emails, prepare for your appointments, and a lot more. So if you are a Kaiser member, that's definitely something to look into if you are expecting. So weight management and healthy lifestyle. These are not everybody needs to use them, but they are there. They're resources. And we like to let people know that these are in place because we don't want you to go through a process and then find out, oh, I should have did it another way. So on our Modern Care and Bronze PPO plans, we do have a weight management program that is available. And it does require you to go through a weight management program. So for the first year of this, you would be going through weight management. You'll be set up with a nutritionist, your doctor, a personal health coach. They're all going to try to give you ways to live a healthy lifestyle and to learn how to eat and to see if you're really ready to have this surgery. There's a lot of mental aspects to the surgeries. So definitely that first year is just to get you prepared. If you go through the program and it's decided you still need to continue with the surgery, then great, your surgery will be approved. If I can tell you, a lot of members go through this and they get to their first year and they don't need the surgery anymore because they've learned how to have a healthy lifestyle. So it's a really great program. If you are interested in it, or if you have a dependent that's interested in it, Sante is the actual administrator of this piece. So you would give them a call at that 228 number here. For our Kaiser members, Kaiser is proactive in everything they do. So they offer lots of programs like a wellness coaching. You can meet with a clinical health educator. They actually have a medical weight management program for anybody that is identified as having 40 pounds or more to lose. I know right now with COVID, a couple of things have stopped or they're pending, but definitely as COVID starts to ease up again, these classes and a lot of the in-person stuff will start to happen again. So estate planning. So this is a really neat feature. What it is you can actually, through your life insurance plan, it's an added service. And what it does is it allows you to do a simple will. So there are other aspects. If you log on to estate guidance, you can get like setting up a trust and a lot of other things. Unfortunately, though, the free portion is just a simple will. So if you decide to do something a little bit further, then you can actually just pay the price to get that done. It is available at no cost, and you have your 30 days to complete it. Once you complete it, if you need to make changes to it, then you may be charged a fee. And you can also find other products such as their final arrangements tool, their living arrangements tool. It's really, really great. So when you have a chance, please go in, check it out. I know it's one of those things we don't like talking about a lot, but it is something that we can do to help our dependents along the path. We also have travel assistance through your life insurance. So that's the actual website that you can log into to register. This is our specific registration code and activation code. So they are in the handout, and hopefully we can get the handout logged in for you guys. But if not, reach out to us and we can get you this information. But what it does is it offers you like a travel assistance program, anything from 100 miles from home. So you can get pre-trip information, emergency personnel services, medical assistance services, emergency transportation services. It's available 24/7 a day, 24/7, 7 days a week, 365 days a year from anywhere in the world, which is really, really great. I can tell you, I've had some faculty members who travel abroad, whether it's for personal or for district reasons, but they go log on to this website, they find out where they're staying at, and they can determine if it's a a nice area, somewhere where they don't have to be cautious, or they can find out, oh, this is an area I need to avoid. They can also find out what vaccines they're going to need at the current moment. So it's a really great resource. Whenever you're traveling, just keep in mind that this is something that you can access. So funeral planning services. This is another benefit added through your Voya Life Insurance. So it's offered through Everest Funeral. And what it is, it's like a concierge service. So if something should happen to you or one of your dependents that are on the plan, you have this service to use. And it's an impartial consumer advocate. And what they will do is they will help you with finding a funeral home. If you need to do some researching on funeral homes in the area, let's say you need to travel to another state to do the funeral, they will help you with that. It's a really great resource in that time of need. So you can definitely go in and check it out. You can see our employer name up there is ASCIP. But we hope you don't have to use this, but if you do, it is there. It is there for you and it's free of charge. And like I said, it's a concierge service. So if they happen to refer you out, then you do have to pay for those services or the products that you buy. So now I'm going to pass it back to Raina.
All right. Correspondences you should never ignore. This is a good one. So Delta Health Systems and Kaiser, but mainly Delta, sends out some forms throughout the plan year. And one of them is the coordination of benefits form. And that one is to ensure that the plan is being billed properly and that if there are other insurances, that they are being accounted for and billed for their portion of the plan. Also, another one that Delta sometimes sends out is a third-party liability. This form is required when a provider has indicated a specific billing or diagnostic code indicated an injury or illness. Sometimes if you're being seen and they think it's a work comp situation or someone else might be liable for the payment of this claim, then they will want that form filled out. Make sure that these forms don't just get tossed in the trash without being filled out. Claims will be put on hold if these forms are not received, and you will be billed for those amounts. So it's really important when you're getting these notices that you're taking a look at them and acting quickly. The next form that comes from Kaiser and Delta Health System is the EOB, the explanation of benefits. This one is sent out 21 days after you receive services, and it's important to note that it's not a bill. So the amount, the patient amount on those forms is not necessarily the amount that you are being billed for, but it's important to take a look at them to make sure that the codes are correct and that you're being billed for services that you actually received. And you want to look at those and compare them to the actual bills that you're receiving from the provider. Sometimes providers don't send in the claims to the insurance company, or they send it to the wrong insurance company. And then you get stuck with a bill and you're like, wait, I didn't receive an EOB. Where's my EOB to see how this was billed? This is more than I thought. And this is going to be a great form to look at and keep track. You will also have access to your EOBs through the Delta and Kaiser websites so that you can check those if it's been a few weeks or a month, over a month, and you haven't received an EOB or a bill. I recommend logging into those portals and checking to ensure everything's being billed properly so you're not hit with a bill out of nowhere. So here's a quick snap of what those forms look like. So make sure that you are taking a look at everything and filling them out completely. If you get any of these forms and you have any questions, I know that there's so many scams and phishing things that go on, but if you ever get anything from Delta, Kaiser, EdCare, or the district, make sure that you're opening all of those correspondences. And if you have any questions, make sure to reach out to our office. Enrolling eligible dependents. I get a ton of questions throughout the year about enrolling and disenrolling eligible dependents. All eligible dependents include legally married spouses, registered domestic partners, a child, either natural, adopted, step, or a child from whom coverage is required due to medical support orders. And those, the children portion, they're up to the age of 26. So if throughout the year you find out that you're expecting, you can reach out to me and we'll get that process started. This is a time-sensitive process. So if you are getting married, going to become a domestic partner, or adopting or having a child, it's important that you reach out to us sooner than later. You have 31 days, including the date of birth, date of marriage, and the dates that these become effective, to notify the benefits department and get the proper forms filled out and supporting documentation. So it's really important throughout the year, during a qualifying life event, that you reach out to the district sooner than later. All right, open enrollment. We are excited here in benefits because open enrollment starts next week. And this is the one time a year through mid-August and through mid-September that you're able to make changes outside of a qualifying life event and outside of your initial enrollment period. Any changes made between August and September become effective October 1st. So if you want to make changes to your benefits and move from one plan to another, or add a dependent, remove a dependent, now is the time to do that. Well, not right now, but effective August 13th. So make sure you're looking out for any correspondence revolving around open enrollment. It's important that you read and review everything to make sure you're informed about any changes being made. Like I said, during each open enrollment period, it's really important to read all of the communication we send out. We spend a lot of time working on this part of the year and this part of our plan. And so we really appreciate it if you could read all of our amazing emails that we send out and all of our documents, and make sure that you're well informed. Something to look out for and that you can do if you hadn't done it during your initial enrollment period is fill out that pre-tax form and any other voluntary benefits. So again, make sure you're just reading everything about open enrollment. Here is a listing of the meetings that we have scheduled to go over open enrollment. On August 24th, it's our large group meeting from 9 to 11. That's where we're going to go over all of the plan changes, costs, and all that good stuff. If you have any questions, then this is a great meeting, an informational meeting with Q&A to attend, just to be in the know. You will be receiving communication soon regarding how to enroll and sign up for these meetings. Also, we've got some informal drop-in meetings. If you've got more pointed questions and want to meet with us one-on-one, we have some options there too. Again, you'll see that and the option of where to enroll in the days to come via email. Here are some snaps of the open enrollment forms. They look very similar to the initial higher enrollment forms. In the emails that we send out regarding open enrollment, you will have links to these forms and instructions on how to fill them out. If you have any questions, feel free to reach out to us in that benefit inbox. Again, open enrollment is also time sensitive. So between August 13th and September 13th, by the end of day on September 13th at 5 o'clock, any forms that are not received and dependent documents that are not received by that time will not be processed. So it's really important that we get a jump on this and you guys are taking a look at these forms. All right, Francis, you're up.
Okay, so another big thing to go over is our triennial dependent eligibility verification review. Now, as I mentioned at the beginning, we are a self-funded health insurance plan. So because we pay for all the usage of the plans, you will see this across the board in any agency that does this, but we do a dependent eligibility review, and this is done every 3 years. So our next review will take place in 2022. And what it does is it requires all employees on the health insurance plans to provide proof of their dependents. As you know, throughout the year, you can have qualifying life events, you can have a marriage, a divorce, You can have, let's say a stepchild on the plan and you're no longer with the mother or the father. So this is one of the ways that we can verify that only eligible dependents are on the plan and are using services. So this is for all of our plans, not just the PPOs, but also the Kaiser HMOs. Our vendor is with HMS right now, and it's contracted through the EdCare group. So in the near future, you will see a large notification go out from the district, just letting you know about this. And then you're also going to receive your individual personalized information in regards to what you need to do and your designated deadline. So for individuals who do not meet those designated deadlines, those dependents that have been unverified will drop off the plans. I can tell you, going through this, what you'll need are the same supporting documents you had when you got hired. So if you submitted a birth certificate, a marriage certificate, you will need those. So we just always recommend just to keep a little folder with all that stuff in it. And that way, when the time comes for our triannual dependent review, you have it. It's easily, you just take the pictures, upload them, and you're done. So definitely keep those documents with you in a little safe place. So your health is very important. We ask that you be proactive and be your own health advocate. Coming from a non-benefits world into the benefits world, it was shocking for me. So it's definitely, I try to give individuals as much information as possible that we have to be our own healthcare providers, our own advocates. What that means is, we're going to go to doctors. Doctors are like businesses. They're running their business, they're running their practice the way they want, but they don't necessarily know you, your care, your body, or your health plans. So it's up to you to know all that stuff. So just remember to keep using your in-network providers in order to keep your own individual health costs low. Know what your plan covers and the services that it covers. There are some exclusions out there, like hearing aids. They're not covered by any of our health plans. So definitely keep in mind that when your doctor refers you out for services, that you are looking into, is this a covered benefit? What am I going to pay? Don't be scared to ask the doctor, can I get like a summary of what I'm going to pay, or to call Delta Health Systems or Kaiser to say, I just want to see what I'm going to pay out of pocket before I actually proceed with the procedure. So different facilities may charge different amounts for the same services. We see this a lot with dental, especially out-of-network dental. So if you happen to not use an emeritus provider and you go to another provider, that's perfectly okay. Your plan's still going to pick up, but it's not going to pick up or provide the same amount as it would if you used in-network. So because the different facilities may charge different amounts, that means if they charge a higher amount than what you're used to, you are going to pay for more out of pocket. So just keep it in mind, as I mentioned, doctors are businesses, so they each run differently. And as long as you use out of network, you will be billed for your out of network charges that the plan doesn't cover. So practice preventative care and wellness. This is doing your annual checkups, your screenings, going in for your regular yearly, checkups. That's all you really need to do to make sure that you're taking and maintaining your health. By completing your preventative care, your doctor can also detect or prevent any serious diseases. So the earlier you catch it, the best it is for you. When you catch preventable diseases early, it can save you money and it will keep you well. And almost all of our preventative services are covered at 100% by the insurance plan, which means you do not pay for anything when you go in. If the doctor says, okay, wait, I need to charge you an out of pocket, or whether it's your copay, your deductible, whatever, either you got something done that wasn't preventative care services, or they didn't bill correctly. So when that occurs, definitely look into it. Look at that EOB and make sure your insuring is paid at 100%. Use your employee assistance program for wellness tips. We're dealing with life. We're dealing with something right now that most of us have not dealt with before, which is COVID. So we need resources. We need to look for tips on how we can maintain our sanity, how we can keep our stress low, what to do, when you need something to do with the kids because we're cooped up in the house all the time. So there's a lot of great resources on your employee assistance program website. So here's some important contact information. We have American Fidelity's number as well as their portal, so you can log in. Here's the CalPERS, CalSTRS, and PARS. PARS is actually for our part-time employees. So if you are a part-time employee or were, and you have a PARS account, you can reach out to them to get some more information in regards to PARS. We also have our voluntary insurance plans, the 403B, the 457s, and that's all handled by district payroll. And we've put the mainline number there. When you call, you just indicate you want to talk to district payroll. They'll transfer you over to whoever in the district payroll office is available. If you need to know what leaves are available to you, let's say you need to take a medical leave of absence. Well, that's going to be here in the HR office, but it's our HR technicians that handle that. So you can reach them by calling the main line. You just identify to the receptionist that you're calling. You are a classified employee, an academic employee, and they will make sure you get to the right person. If you have a general human resources question, you can just call our main line. Our receptionist is amazing. I can tell you she's either going to know the answer or she's going to know who to refer you to. So keep that in mind. So questions, anybody have questions for us? Please just talk to us or ask in the chat if you want, and we'll go through it whichever way, but we have a lot of time now left for questions.
Why don't we go ahead and since Gerard has a question.
Okay.
Hello, thank you. I apologize. I showed up late. I was caught up in another meeting. What's the timelines for submitting our health preferences for our plans?
So as an initial new hire, if you're completely new to the district and not enrolled in any health plans, and you just got hired, let's say August 6th, August 4th, you have 31 days, including your date of hire, to submit your new hire enrollment forms. In addition, you also have the open enrollment period. So let's just say, let's do a hypothetical. Let's say you all got hired today. This was your first day. You have until September 6th to actually get your enrollment forms done as a new hire. Your medical, dental, vision, everything is going to kick in September 1st. And then you decide, oh, wait, during open enrollment, I want to change medical plans. You can do that during the open enrollment period. And then come 10/1, you'll be on your new medical plan. So just keep in mind right now, you're coming on in a funky little time period where you have your initial hire, and then we also have open enrollment.
And I'm sorry, I don't know open enrollment dates right now.
Open enrollment is going to start August 13th, and it'll run through September 13th for an October 1st effective date. So we haven't officially sent out any notification on open enrollment. It should go out today. And then we officially start next Friday.
Okay, and then all the forms are digital?
They will be a digital. We will have a dedicated open enrollment website with all the information, all the forms, videos, lots of good stuff.
Thank you.
You're welcome.
And I saw Victoria had her hand raised and then she lowered it. Victoria, did you have a question?
They answered my question. I think I'm used to open enrollments happening later. And so I was just making sure I understood the dates, and you just repeated them for us, which is they do not happen at the end of the fiscal or like at the end of the year, like other institutions might practice in like November. So it is coming up ASAP.
Yes.
Thank you.
Yes, and the reasoning is because it's going to be tricky, but our health plans run October 1st through September 30th of every year. So any plan changes that occur will occur October 1st. I said October 30th, didn't I? It's October 1st through September 30th. So any plan changes will be effective October 1st. However, for your deductibles, your co-pays, your out-of-pocket maximums, those all run calendar year. So January 1st is when your deductibles, your annual benefit for your dental we renew. So it's a little tricky. I know it's confusing, but a lot of school districts you'll come to find are on this October through September type plan. Does that help?
Thank you.
You're welcome.
And Rain has been doing an incredible job of answering questions in the
Thank
chat.
you.
Nalene asks, does date of hire mean first contractual date?
Yes, it does. I see some stirs. So if you're, I know only because I've been here forever. If you are enrolled in STRS, you can continue to maintain enrolled in STRS. When you came on and did your new hire onboarding with our HR techs, they should have mentioned there was a form you're going to fill out. So if you don't recall that form, you can reach out to our HR techs or our payroll department so that they can ensure you're enrolled in your correct pension system, whether it's CalPERS or CalSTRS.
Nalene?
Hi, I was wondering, I know that our health insurance plans don't start until September, and some of us are in the classroom before then.
Mhm.
I was wondering if there are any resources available if any of us contract COVID during those days we don't have health insurance yet. Does the district have anything that we could use to help cover those costs?
There are some new regulations coming out with the CDC, federal government. I can look into that for you and definitely get something out.
Thank you.
Whether it's, yeah, I'll try to do it. Susie, is there any way for you to get like a listing of everybody in the meeting today?
Absolutely. I'll send you the participant list.
Great. So I'll follow up with everybody with that through an email once I'm able to find out from the rest of our HR team.
Z asks, why is it that our dental vision insurance plan is effective 6 months after hire?
So that only applies to our classified members, and that is the probationary period. It's just what's set up in our the bargaining unit for classified members. Faculty, confidential, and management don't have that 6-month waiting period. All of their benefits, medical, dental, vision, and life, become effective the month following their date of hire.
You guys have a lot of good questions. I love it.
Anybody else have any questions? I'm sorry, Francis, I had to step away to troubleshoot another session. Did you cover the EAP?
I did, yes.
Because I know we had a question yesterday at convocation asking if the EAP was available for our adjunct faculty. And they were told she was told it was not.
Right. For our part-time individuals, unfortunately, EAP isn't a benefit that's offered to them. However, if a EAP, or excuse me, if a part-time employee or any employee has a situation that's determined like a triage situation where they need assistance, they can work through their manager and we can get them referred over to EAP. So any other questions? I'm sure you guys will have some as you get through your new hire stuff and as you go through open enrollment. One of the things we hear a lot, just so I can share with you since we have a few minutes, is if you have a spouse or a partner and you're enrolled on their health plans, just make sure it's coordinating or that you're not going to have interference with your care if you're receiving care because of the different health insurance plans. As Raina mentioned, we have the PPOs that coordinate with other PPOs, and the Kaiser HMOs only coordinate with Kaiser HMOs. So once you become enrolled in a district plan, your plan here, it will become your primary. So if you happen to use the other insurance plan you have, you may come across some coordination or billing issues. So if you have that situation and you want to talk it out more with us, please do so. We can help you navigate that piece. We definitely don't want you to get into a plan and think you don't have to use it, and then down the line the insurances find out you had a different primary plan and now they're going to retro adjust all your claims and your bills. That's a little scary. We have had it happen. So we like to help you guys out as much as possible. Yeah, anything else you can think of, Raina?
I saw
Mark has a question. Yeah. Sorry, Raina. I stepped on you.
It's okay. His question is, I realize that Kaiser does not coordinate with other health plans. However, can you bill our health plan for Kaiser co-pays and etc.?
Mark, I'm not sure I understand. Are you able to unmute? And
Yeah, so what I'm asking is if we have Kaiser, right? And so out of pocket, co-pays, co-insurance, procedure prices and things like that.
Mhm,
If we incur those, someone incurs those, let's say spouse,
mhm.
can we submit a claim to EdCare? Or whoever does.
So you're saying that you have Kaiser, okay, okay, go ahead,
One
Francis.
person has Kaiser, the other doesn't.
Yeah, so
And they incur, so since they can't be primary and secondary, can we manually file a claim with our insurance?
no, unfortunately, I mean, you can try, but they're gonna deny it. Kaiser will only pay in-house Kaiser claims.
No, not have Kaiser pay. I know that, but I mean,
Have EdCare.
have EdCare cover it.
Yeah, they won't pick up any Kaiser bills either.
Okay,
I mean, what you could do is during open enrollment, you jump on the same plan so they coordinate. A lot of times, what we have individuals do is if they have an outside plan that's richer than our plans, like let's say you have a spouse that has 100% PPO plan,
mhm,
you can enroll on the bronze plan, and that way you're paying less in premium, but yet your benefits will go up to what her PPO plan has.
okay,
I mean, we do see that happen with individuals because they have the dual insurance. I know it's sort of a hassle because our plans do not currently allow for anybody to opt out. So employees do have to enroll in a plan, and many times we do see, individuals enroll in the Kaiser Low. Kaiser Low will be your primary, and you can use the PPO, and more than likely they probably will never talk or never they don't talk to each other. We know that. But there could be an instance when something gets triggered and they find out you've had Kaiser. And in that situation, that's when they can go back and retro all the claims and bills that they've been paying for.
okay. Because I know one time if you used an out-of-network physician and incurred medical costs, you could submit that claim to the insurance companies. And I guess ours had never done that, but I've been to businesses where that is done. That was my question.
Yeah, unfortunately, not Kaiser PPO. Kaiser and PPO are just sort of very strict. If you used other PPO providers and they weren't in network in the Anthem network, then yes, you can use your out-of-network PPO benefits for that,
Right.
but not Kaiser.
Well, sometimes you have like the situations where you have anesthesiologists and stuff that do not take any health insurance. So what do you do with their bills?
Their bill should be picked up at 100%. You brought up a good point. When you go in to have services and you go into a PPO provider or a provider on your network, doctors are their own businesses. So the anesthesiologists are their own people, the doctors are their own people, the facilities are their own people. But if you have an approved procedure that is being done, all of that should get picked up as it's in network. If one of those providers bill you and they try to bill you as out of network, you need to bring it up to our attention.
Okay, because I've seen that with anesthesiologists, pathologists. They tend to bill at the full rate, their full rack rate.
Yep. And basically what we do is we get our broker involved, we get Delta Health Systems if you're on the PPO involved, and we get that process correctly because it should be no fault of your own. You don't get to go into the surgery room and say, oh, well, I want to make sure all these providers are in network.
Right.
You're under, you don't get to do that. So when you choose these facilities, they should be maintaining and ensuring they're all in network, and they should be making sure that all those providers are getting paid as a network.
Okay, thank you.
You're welcome.
I just wanted to jump in about Vision and Kaiser. VSP is our Vision administrator. So to have those claims paid out through the district, you will need to use a VSP provider. Francis, do you know if Kaiser accepts that?
No, I can tell you that what will happen is, let's say your VSP, your glasses, you'll get those through VSP. But if you happen to have like an eye infection or an eye issue that you need to go in to be seen for, that actually is going to run through your medical plan. So that will be Kaiser. And I can tell you that my eye doctor knows right away, hey, you have this eye problem you're dealing with, it needs to go through your medical, so you have to go to Kaiser. So your eye doctors should be well aware when they're treating you, which health plans you have so that they can make sure your care is getting coordinated correctly.
Okay, and then the next question around vision is, you know, you are not obligated to get glasses, contacts, where you get your exams. However, if you are buying them online, it does have to be through a provider or an entity that accepts VSP in order to get that frame payout and that lens payout. You can use VSP's Iconic. Another option, which because I wear glasses, I do this often, is I make sure I set up that flexible spending account and have money set aside, and I use that for my frames and any upgrades, or if I wanted to go and get a second pair or any upgrades to those frames, then I would use that flexible spending account to offset our vision plan. So that's another option. And for the list of providers with VSP, you're going to want to go to their portal. Yeah.
Yeah. Eyeglasses, yes. You know, our VSP plan covers Costco. It covers Sam's Club, Walmart. So, and you can find cheaper discounts, you know, at a lot of places. So once you get your prescription, take your prescription and just go searching around for glasses. You know, anywhere works. I gotten these last pair at Costco because I got 2 for the price of 1. So I couldn't go bad there. But definitely, you know, do your shopping. If you happen to use out of network, meaning they don't want to bill VSP directly, you can always get your receipts and submit them to VSP through their out of network reimbursement process. EMS and ambulances are within the network. If you happen to get a bill for one of those, work with us or Delta Health Systems to get that paid. Because we don't have any contracted ambulance area in the area, Delta Health Systems has to do a little bit more to get those claims processed.
You all
Thank
had great
you,
questions.
Francis. Yeah, thank you, Francis and Raina. And thank you for everybody for joining us. We're at time.
Thank you.
So Francis will share with me her slides and I'll post them on the Padlet, and an email will be going out to you guys where you can access that. Also, this session's being recorded and it'll be on the Professional Development at Fresno City College YouTube channel. That will also be in the email when I give you the link to access the slides. So thank you for joining us. Enjoy lunch, and I'll see some of you guys at 1 o'clock. Thank you.
Thank you. Thanks.
And thank you to Stephen and Shannon for interpreting.
Yes, thank you.
Thank you. Have a great day. Bye.
Bye-bye.